Tucker is the follower of Dr. Ian Stevenson, who was one of the pioneers studying reincarnation here in this country. And he has a book, has a book that studies and documents reincarnations. And Dr. Jim Tucker works more with children who remembers accounts from past lives. And he follows on that to find the proofs of that past lives. One of his more recent works was done with children who remember past lives, and they also have birthmarks. So he went on doing some research, looking through what birthmarks, looking for what they remember. He goes and do some research, and he truly found some cases where he found what happened in the past life that now comes as a birthmark in this child. So he has a fascinating book. He gave a lecture in the past Spiritist Medical Congress in 2010. Fascinating cases with pictures. It's worth reading his book, which is called Life Before Life, but he's writing another book which is coming soon, and he has several articles with pictures and so forth and so on. It's really fascinating. So that is to show that the marks, whatever went through in the past life, the body died, but reappear in the new body, in this incarnation. So how that mark reappeared? Through what was imprinted in the perispirit, imprinted. And of course, this doesn't happen to everybody. You know, many of us do not have any birthmarks, physical, but we have remembrances, we have traits in our behavior that are also imprints from the perispirit. So when this imprints, today we don't have time to talk about that, but when this happens, it happens for a reason. Everything has a reason. So if the imprints come back, there must be a reason for that. But anyway, this is only to tell you that if we want to learn more about the perispirit, we can also read Dr. Tucker's book. Now, in the past like 20 years or so, there's a lot of studies that have been done by physicians, by nurses, by people in healthcare about religiosity and health. So there are several studies correlating religiosity, spirituality with all these symptoms here, especially with stress, hormone levels, immune function, and brain activity. Okay? So a lot of papers being done, and up to 2006 there were approximately 350 studies examining, the relationship between religiosity and health. And in these studies they show that religious people live longer and healthier, and that they have better mental health and adaptation to stress, meaning religiosity really helped. Now, there were about 350 studies up to 2006. My recent research showed 942 publications on this issue. So a lot of people are studying this. This is really a hot topic. But there is a difference between religiosity and spirituality. This is what the researchers found. Because when they started doing their research, they started by a questionnaire. And the questionnaire was, do you go to church? Do you pray? Do you believe in God? Things like this. Or you believe in something that's not material, meaning do you belong to a religion, or you are like a spiritual person who believes that we are not just in the material world, there's something else there, but I don't belong necessarily to a religion. I may believe in a God that, it's a superior being, but I don't know whether it's a Catholic God or whatever else God. So anyway, they made this distinction because there's a lot of people who go to the church, but they're not that spiritual. They go almost like a social, right, event. So spirituality, they defined, and this was you can find in this paper, it's a scientific paper published in 2006. Spirituality is all the beliefs and activities by which people attempt to relate their lives to God or a divine being or some other conception of transcendental reality. So that embraces all religions and non-religions, but one who believes in a superior being. Religion, on the other hand, is the outward practice, is a practice, right, of a spiritual system or belief. They have values, code of conduct, and rituals. It is a platform of the expression of spirituality. Now, the interesting thing is that in most cases they found that spirituality showed more benefit towards health than religiosity. So we're going to see this. For example, in this paper here, which was published in 2002, was a group who studied HIV patients. And they conducted a questionnaire asking about religious behavior, if they pray, if they attend services, and they counted those immune cells that we were talking about. Okay? They just have a questionnaire and they counted the cells. And they came up with the result showing that those who, through the questionnaire, were considered spiritual were associated with lower cortisol and long-term survival. Okay? So remember that hormone that I talked about, cortisol, which kind of regulates the immune system? They had a lower and a much better survival rate. Okay? They had not done anything. They just did the questionnaire and related to the results. Now, this is another work that was published in 2009. This group used mindfulness meditation training, and they had a 8-week program, 30 minutes per day versus 1 day, and they counted cells, CD4 positive cells, which are, again, another type of those immune cells that acts against disease. And they found that the training of 8 weeks, they counted the cells prior to the training and after the training, and they found that this would decrease the number of these cells. Now, another group looked at metastatic breast cancer. Okay. Breast cancer itself is already a difficult situation. When it's metastatic, it's a more advanced, more severe. So they were studying these cases where the women had already metastasis, and they were looking at the importance of spiritual expression. Questionnaire would ask, how important is religious or spiritual expression in your life? And they should, rate, not important to very important. In attendance at meetings, how frequently do you attend religious meetings, services or meetings? From rarely, not at all, to several times a week. So they did this questionnaire to these women. And what is the result? They found that patients reporting that spiritual expression was important, not just going to service, but spiritual expression was important, had great numbers of white blood cells, especially lymphocytes, which were kind of trying to attack the disease. And they had also a better response to treatment. Here is another study, 2008, patients with lung cancer. And they studied 30 patients with, again, metastatic lung cancer and 100 healthy volunteers. They again did the assessment, through questionnaire, and they counted the lymphocytes, the white blood cells, and also cortisol level in the blood. And the results, patients with higher spirituality